We were always in silos before, so there was always the physician office group, the hospital group, nursing home, home health, you name it. We had lots of different groups that we were working with, and not everyone knew what others were doing. We had folks who were contacting the same place twice, 3 times.
I'd have a provider that might have been working on 2 different projects, but I didn't know that they were working on 2 different projects. I just knew about the one that I was working with them on.
Nothing is more embarrassing than when I go out and I'm working with a provider on a project and they say, oh, I'm working with so-and-so in your office on this. And I'm not able to speak to that, and I didn't know that, and it looks like we're disjointed.
So by making it integrated, it reduces that burden on some of our providers, as well as makes our staff learn more and more about different topics that they wouldn't normally know about.
I lived in this ambulatory world, so I lived, internal medicine, pediatrics, OBGYN, and now we can sort of see healthcare as the whole, across the entire continuum.
When the whole idea of this big integrated one Medicare team was presented to us, that everybody was a little overwhelmed thinking that they had to be a content expert in everything.
I would say I worked on C6, Benny protection, C7 for hospital reporting, and C9 prevention. And if you ask me that same question here in the 11 scope, I would say I work on the one Medicare team where I have a base knowledge of all of the tasks, but I try to be a content expert in tasks B1 and B2.
At first, I did not buy into it. I was kind of a little unsure, a little shaky, saying, how are we going to work all of this out? At times, it is probably easier to go back into our cocoons and work in our little silos.
We just are a much more cohesive team, understanding the different wheels that are turning and being able to speak to the different projects and being prepared, knowing when you go to a meeting with a provider out in the community that you know that they're involved in X, Y, and Z task and how we can help them align all of their efforts.
We're able to share technical assistance, we're able to share recruitment, and then as far as the lands, instead of everybody doing the same thing over and over again or multiple lands within a month, everybody is integrated and we're sharing the work.
It works out very well. I'm able to know that my providers is not only working on my task, but they're working on other tasks. And it works out well for the provider because we're able to offer them a better service.